Assalamualaikum warahmatullahi ta'ala wabarakatuhu. Good day to each and everyone. So in this video, we will start our discussion for Fundamentals of Nursing NSG120 or NCM120. So dito, tatalakayin natin yung Unit 1, the nature of nursing. So in this unit, we will discuss different topics such as nursing as a profession. What is the definition of nursing? The definition of profession, the historical perspectives of nursing, the known nursing leaders, okay? And also the roles and responsibilities and the scope of nursing based on RA 9173. So yun yung mga iba't ibang topics na i-discuss natin sa unit na ito. So before we start our discussion on this, on that certain topics, ipapakita ko muna sa inyo yung mga course outcome for this subject. So first, we have integrate relevant theories of nursing and the performance of different phases of nursing process. Okay? So you have done or you have finished your theoretical foundation of nursing. So I think you're very well familiar, okay? And very known na sa inyo yung mga iba't ibang nursing theories na malaki yung impact niya sa ating profession. Next, utilize the nursing process in the care of individuals, families, population groups, and community. Third one, implement standards of evidence-based practice in translating knowledge and skills and fundamentals of nursing across all patients in a different clinical setting. Next, incorporate ethical legal considerations when performing nursing procedures. Next, observe proper communication techniques and establishing working relationship with client, significant others, and health team members. We have also to observe proper documentation and ensure security of information. Dito kasi sa Fundamentals of Nursing, dito hindi din matututunan yung pinaka-basic na mga procedures na anong gagawin natin. Diba, you have your NSG120 or NCM120.2, yun yung ating skill side na in which doon na discuss yung mga iba't ibang basic or mga routine procedures na ginagawa ng isang nurse sa hospital. So we have also recognized the importance of collaborating with intra, and multidisciplinary and multicultural teams. We have appreciate the significance of being a nurse manager at the same time a leader in the different health settings. We have also participate in varied continuing professional development activities, practices the core values of Philippine nursing profession, and lastly, to project the positive professional image of a Filipino nurse. So, yun yung course outcome ng subject na ito na NSG 120 or NCM 120. So, let's talk about the historical perspectives of nursing. So, 'di ba, we have different periods, okay? Intuitive period, we have apprentice nursing, dark period of nursing, educated, and now ngayon as the present kasama tayo sa contemporary nursing. So, ang daming pinagdaanan ng ating profession para maging accepted siya sa community or sa society, and also para mas ma-improve yung knowledge and skills of a professional nurse. So, traditionally, okay, the woman's role or female roles of wife, mother, daughter, and sister have always included the care and nurturing of other family members. So, yun lang talaga yung roles natin. Maging nanay, maging asawa, maging anak, and maging sister. Okay? From the beginning of time, women have cared for infants and children. Thus, nursing could be said to have its roots in the home. Kaya, isa sa mga, pinaka-renowned, kumbaga, na responsibility natin ng mga nurses is to care for our patient. Kasi traditionally, ang female roles talaga is being a wife, mother, daughter, and sister. At yung mga roles na yon, di ba, lahat yun siya nagagampanan in a way that you render care to one another or to other person. So, additionally, women who in general occupied a subservient and dependent role were called on to care for others in the community who were ill. So, dahil doon na yung role natin nga na maging asawa, maging nanay, maging anak, at maging sister, okay, dati, or nung unang panahon, pag may nagkakasakit daw in a community, so sila yung pinapatawag para paalagaan yun siya, okay? Kasi, there's really a difference with the innate moral values of a woman and a man. Okay? Kasi ang mga women, mas mahahaba yung pasensya nila compared to men. At kumaga, innate na sa atin, nasa nature na natin na we're very caring person. Unlike mga males. Okay? So for religion has also played a significant role in the development of nursing. Although many of the world's religion encourage benevolence, it was the Christian value of the love thy neighbor as thyself and Christ's parable of the Good Samaritan that had a significant impact on the development of Western nursing. So hindi natin makakaila na very into religion. Okay, yung field ng nursing, especially sa mga non-Muslims, okay? Hindi masyadong natalakay yung Western nursing sa ating Islam side, okay? Kasi, syempre, lahat ng mga theories natin are non-Muslim. So, but magkakapareho lang din talaga yung sinabi ng role ng mga babae from the Quran and from the Bible itself and from different religion na not Islam. Okay? So, pare-pareho lang yan. So, dito sa Christian value na love thy neighbor as thyself. So, mahalin mo yung kapitbahay mo kung gaano mo kamahal yung sarili mo. And also the Good Samaritan law. Diba? Yung Good Samaritan, you are caring for, kumbaga iniisip mo yung kapakanan ng maraming tao in times of they are in need. Okay? So for societal attitudes, the society's attitudes about nurses and nursing have significantly influenced professional nursing. Before the 18,000s, nursing was without organization, education, and social status. So, before, hindi pa siya kilala, kumaga hindi accepted, okay, nursing, wala lang yan, ganito, ganyan. Hindi nakitaan ng importansya yung field ng nursing. So, the prevailing attitude was that a woman's place was in the home and that no respectable woman should have a career. So, bawal magkaroon ng career. Actually, baka may mga, until now, I think, meron pang mga traditional na mga tao na ganun din yung paniniwala nila na hindi dapat nagkakaroon ng career yung babae kasi dapat yung lalaki na yung bumubuhay sa family nila at yung babae dapat nasa bahay lang. Pero as time goes by, nagiging modern na tayo. I think you have your mother na sila yung career woman, okay, sila yung naghahanap buhay, and then your father nakaka-stay sa bahay kasi nga naiba na ngayon yung mundo, okay? So the role for the Victorian middle-class woman was that of a mother and a wife, and any education she obtained was for the purpose of making her a pleasant companion to her husband and a responsible mother to her children. Nurses and hospital during this period were poorly educated, and some were even incarcerated criminals. So, hindi masyadong maganda, okay, yung tingin sa atin ng mga ibang tao nung sinaunang panahon. Pero ngayon, we are thought highly. But, okay, unfortunately, hindi dito sa Philippines. We're not loved by our own. Okay? Mahirap man tanggapin yan, napapansin natin, at siguro naman, napapansin nyo din sa mga news, ang daming napapahiyang mga medical professionals. Hindi katulad sa ibang field, okay? Hindi ko sinasabing kung pero hindi nyo siguro nakikita yung mga civil engineering, electrical engineers, mga architecture na papahiya sa social media. Masyadong marami yung napapahiya yung na mga taong into medical field. Okay? So, yan yung masama dito sa atin. Kasi masyadong malaki yung mga sinasabi nila against us but they cannot understand yung state natin na ginagawa natin yung trabaho natin at we're not really compensated good. Dito talaga sa Philippines, very poor yung healthcare natin na umaabot sa yung mga nurses, mga medical practitioners ay hindi compensated ng maayos. So, 'di ba kaya nga yung mga iba sa atin siguro gustong mag-abroad kasi nga malaki yung sweldo. Yes, hindi natin yan makakaila na mas malaki talaga yung future natin sa abroad kaysa dito. Sad to say. Okay? And then during war, syempre, 'di ba, we have the Crimean War kung saan doon nakilala si Florence Nightingale. I think kung hindi nangyari yung war, I don't think so na ma-recognize yung field ng nursing. So throughout history, wars have accentuated the need for nurses. During the Crimean War, 1854 to 1856, the inadequacy of care given to soldiers led to a public outcry in Great Britain. So the role of Florence Nightingale played in addressing this problem is very well known. She was asked by Sir Sidney Herbert of British War Department to recruit a contingent of female nurses to provide care for the sick and injured in the Crimea. Nightingale and her nurses transformed the military hospitals by setting up a sanitation practices such as hand washing and washing clothing regularly. So, 'di ba, very known si Florence Nightingale as the Lady of the Lamp and also sa kanyang environmental theory. Okay? So, yun ang ating historical perspective. So, now let's discuss naman yung mga known leaders. Okay? Kung sa inyong TFN na-discuss yung mga theorists. Now, ito naman yung mga nursing leaders na nakilala at nagbigay contribution sa ating field. So, syempre, the contributions of Florence Nightingale to nursing are well documented. Kaya nga, di ba, nang dahil sa kanya, nakilala ang profession natin. Her achievements in improving the standards for the care of war casualties in the Crimea earned her the title Lady with the Lamp. Her efforts in reforming hospitals and in producing and implementing public health policies also made her an accomplished political nurse. She was the first nurse to exert political pressure on government. So, siya yung nagpakilala talaga na kung hindi nyo talaga i-recognize, parang siya yung nag-stand na, okay, kung hindi nyo i-recognize yung field natin, walang mangyayari sa society natin. So, pinakita niya talaga, pinadama niya sa mga tao na we are very needed by the community. So we have also another leader, si Clara Barton. She was a school teacher and who volunteered as a nurse during the American Civil War. Her responsibility was to organize the nursing services. Barton is noted for her role in establishing the American Red Cross, which linked the International Red Cross when the U.S. Congress. So doon pinakilala niya sa US Congress ng ito yung American Red Cross na kung saan 'di ba yung American Red Cross is kilala sa pagbibigay tulong sa mga poor, okay, yung mga hindi capable na mga tao to have health services enough, 'di ba, kasi mga pobre sila or malalayong lugar. So, yun yung ginawa niya. So, para magkaroon ng linkage at ma-accept ng US Congress yung recognition of the American Red Cross. Another leader, we have Linda Richards. She was the America's first trained nurse. She graduated from the New England Hospital for Women and Children in 1873. Richards is known for introducing nurses' notes and doctors' orders. She also initiated the practice of nurses wearing uniforms, and she is also credited for her pioneering work in psychiatric and industrial nursing. So, siya yung nag-introduce ng mga nurses' notes such as yung ating FDAR or yung SOPI. FDAR stands for Focus Document Data Action and Response. And then for SOPI, we have S for subjective cues, O for objective data or objective cues, we have A, assessment, we have P, planning, we have I, implementation, and E for evaluation. So, may mga iba't ibang hospitals na ginagamit yung FDAR, may mga iba't ibang hospitals din na ginagamit yung SOPI. Okay? So another nursing leader, we have Mary Mahoney or Mary Mahoney. She was the first African American, so she is black, okay? So professional nurse. She graduated from the New England Hospital for Women and Children in 1879. She constantly worked for the acceptance of African Americans in nursing and for the promotion of equal opportunity. So hindi makakaila na nagkakaroon, di ba, meron tayong racial discrimination against black. Okay? So doon sa US, masyadong kilala 'yan. So sa kanya si Mary Mahoney talagang pinakilala niya, oy, kailangan yung i-accept to. Pinaglaban niya yung rights nila as a black. Kasi kahit naman black sila, still they're American. So gusto nila makakuha ng equal opportunity. So the ANA, or Association of the American Nurses Association, gives Mary Mahoney Award biennially in recognition of significant contributions in interracial relationships. So, yung mga nurses na nagkakaroon ng achievement with interracial relationships, kumaga makakabigay sila ng magandang inputs regarding sa racial discriminations. So, they are being awarded na Mary Mahoney Award. So, another leader, we have Lillian Wald. She was considered the founder of public health nursing. So Wald and Mary Brister were the first to offer trained nursing services to the poor in the New York slums. So yung mga kumbaga sa dito pa sa Philippines, yan yung mga squatter area, okay, the slums, pinasosyal lang sa kanila. Pero sa atin yung mga squatter, okay, so yan. So doon sila nagbigay ng mga nursing services. So their home among the poor on the upper floor of tenement called the Henry Street Settlement and Visiting Nurse Service provided nursing services, social services, and organized educational and cultural activities. Soon after the founding of the Henry Street Settlement, school nursing was established as an adjunct to visiting nursing. So, dahil din sa contribution ni Walt, nakilala din yung ating school nursing. Okay? Another leader, we have Lavinia Dock. Okay, she was a feminist. Pag sabihin natin feminist, very pro-feminine siya, or very, very pro-female. Okay, a prolific writer, political activist, suffragette, and friend of Wald. She participated in protest movements for women's rights that resulted in 1920 passage of 19th Amendment to the U.S. Constitution, which granted women the right to vote. In addition, Dock campaigned for legislation to allow nurses rather than the physicians to control their profession. So, dahil kay Lavinia Dock, naging more on independent na tayo. Kasi 'di ba sabi nila, pag mga nurses, made yan ng mga doctors kasi kung wala yung mga doctors, hindi sila makakagalaw. So, siya yung nag-separate ng entity ng mga nurses sa physician. So, hindi tayo under sa physician because we are independent profession. Okay? So, another at nursing leaders, we have Margaret Higgins Sanger, or Sanger, may iba-iba yung mga pronunciation nila, a public health nurse in New York, who has had a lasting impact on women's health care. She was imprisoned for opening the first birth control information clinic in America. She is considered the founder of Planned Parenthood. So yung mga family planning programs, the different family planning methods, she introduced that one, okay? So her experience with a large number of unwanted pregnancies among the working poor was instrumental in addressing this problem. Kasi syempre, 'di ba? Isa kasi sa mga reasons bakit nagkakaroon ng poverty is yung increasing population. Pag kasi lumaki yung family population nyo talaga, mahihirapan yung parents ninyong maghanap ng trabaho para mapakain kayo. So that would result to poverty. Okay? So last na leader, we have Mary Breckinridge. After World War I, she was a notable pioneer nurse who established the Frontier Nursing Service, or FNS. In 1918, she worked with the American Committee for Devastated France, distributing food, clothing, and supplies to rural villages and taking care of the sick children. So yan si Mary Breckinridge. Okay? So now let's discuss naman yung nursing education. So kasi 'di ba baka sabihin niyo, "Ma'am, nakagraduate sila ng nursing, yung mga nursing leaders natin." Is it the same with our typical na tinetake ngayon na nursing program? Hindi. Kasi before magkakaiba yan siya. So as we go along, nagkakaroon ng improvement. 'Di ba? Siguro naman napapansin niyo yung ating curriculum din paiba-iba din kasi may mga nababago. At may tsaka may mga research tayo na based sa mga research pag napatunayan, ito kailangan to siya sa ating curriculum. So nai-add or na-omit natin siya. So the practice of nursing is controlled from within the profession through the state's Board of Nursing and Professional Nursing Organizations. These groups also determine the content and type of education that is required for different levels or scopes of nursing practice. So, we have different types of nursing practice. We have first the licensed practical or vocational nursing programs. So, practical or vocational nursing programs are housed in community colleges, vocational schools, hospitals, or other independent health agencies. So, these programs generally last to 9 to 12 months and include both classroom and clinical experience. So, para siyang, kung dito sa atin sa Philippines, we have TESDA. Okay, yung TESDA, may mga courses doon na allied health courses. So, pwede yun siya na licensed practical nursing program. So, at the end of the program, the graduates take the NCLEX PN, okay, practical nursing, to obtain licensure as a practical or vocational nurse. So, these practical nurses work under the supervision of a registered nurse in numerous settings. So, pag-isipin natin dito is para siyang nursing aid, pero meron silang licensure exam. Okay? Yun yung kagandahan sa US. Meron silang, examination for practical nursing. Okay, para naman they are capable of doing the very basic na mga ginagawa ng mga nurses such as yung pagkuha ng vital signs, pag-insert ng IV, yan yung mga ginagawa nila. So, we have also the registered nursing programs which is currently 3 major routes lead to eligibility for RN licensure. We have the completion of diploma, associate degree, or baccalaureate program. Pag sabihin nating diploma programs, yan yung nursing educations in early years largely took the form of apprenticeship program. So, parang a 3-year diploma programs were the dominant nursing programs and the major source of nursing graduates from the late 1800s and 1800s and mid-1960s. Today's diploma programs are hospital-based educational programs that provide rich clinical practices for nursing students, and these programs are often associated with colleges or universities. Okay, yan yung ating diploma. So, mga 3 years lang siya na diploma programs. Pag sabihin naman nating associate degree programs, the associate degree nursing programs which arose in early 1950s were the first and only educational programs for nursing that were systematically developed from planned research and controlled experiments. So, most of these programs take place in the community colleges. The graduating students receives associate degree in nursing or associate of arts or associate of science or associate in applied science degree with major in nursing. So, dito sa atin meron tayong ASE. Dati yan siya. Associate degree yan siya. Before naging BSN or Bachelor of Science in Nursing, meron tayong tinatawag na ASE, Associate of Healthcare Service. Nakalimutan ko yung pangalan niya or the meaning, but it is ganito, ASE. Parang ganyan siya. So, it's 2 years. Okay? And then, tsaka sila mag-proceed na naman sa curriculum ng nursing another 2 years naman para makatake sila ng board exam. If hindi kasi sila magte-take ng hindi sila mag-proceed to 2 years, pwede sila mag-take ng board exam na practical nurse. Ganyan din yung dati. Okay? And pag sabihin naman nating baccalaureate program, ito na yung 4 years course of nursing, which is general 4 years in length, and the programs include courses in liberal arts, science, humanities, and nursing. So, ito na yung ina-award natin na BSN. Okay, yan yung ating baccalaureate program. And we have also another type of nursing education. We have graduate nursing program. So, it's either master's degree programs or doctoral program. So, madaming pwede nating ma-take up na master's degree. Pwede yung MAN or Masters of Arts in Nursing. We have also MN, Masters of Nursing. We have MSN, Masters of Science in Nursing. So, magkakaiba yan sila. Depende yan sa gusto ninyong i-take up. And then, syempre, sa master's degree na din yan, meron ding iba't ibang fields, okay, or mga majors. And then, we have also doctoral programs such as Doctor of Philosophy, Doctor of Education, Doctor of Science in Nursing. So, magkakaiba yan siya, okay? So, yan ang acting nursing education. Now, let's talk about the contemporary nursing practice, or dito natin i-discuss the nursing as a profession. So, let's start with the definition of nursing. So, ang daming definition ng nursing. Kasi nursing is an art, nursing is a science, kung ano pa man dyan. So, based kay Nightingale, nursing is the act of utilizing the environment of the patient to assist him in his recovery. Again, it is the act of utilizing the environment of the patient to assist him in his recovery. Yan yung base sa kanyang theory na environmental theory. So, nakikita nyo, more on, sabi niya is, pag binabago natin yung environment ng ating patient, nagkakaroon ng improvement with their well-being. So, Nightingale considered a clean, well-ventilated, and quiet environment essential for recovery. This is quite quiet. Okay? Yan. Typographical error. And then, based naman kay Virginia Henderson, which is one of the renowned nursing theorists, she was on the first modern nurses to define nursing. She wrote, nursing is the unique function of the nurse is to assist the individual, sick or well, in the performance of those activities contributing to health or its recovery that he would perform unaided if he had the necessary strength, will, or knowledge, and to do this in such a way as to help him gain independence as rapidly as possible. So, gi-highlight ni Virginia Henderson, tayo yung tumutulong sa mga patient natin para ma-achieve yung independence. At masasabi natin yun siya na independent na yung isang patient if hindi niya kailangan yung ating services at nagagampanan niya yung mga roles niya based on his or her own strength, will, or knowledge. So, another definitions, we have nursing is caring, nursing is an art, nursing is a science, nursing is a client-centered, nursing is holistic. Pag sabihin natin holistic, buong-buo yan. Lahat, ikukompleto mo yung physical health, mental health, social health, emotional health, spiritual health, kung ano pa mang health or components of health nandyan. Nursing is concerned with health promotion, health maintenance, and health restoration. And overall, nursing is a helping profession. Okay? We help one person or one individual to be an independent individual in the society. Okay? So, what is nursing as a profession? So, a profession has been defined as an occupation that requires extensive education or a calling that requires special knowledge, skill, and preparation. So, what are the criteria of a profession? So, first, a profession is generally distinguished from other kinds of occupation by, so, ito yung mga criteria niya. We have its requirement of prolonged specialized training to acquire a body of knowledge pertinent to the role to be performed. So, tayo dito, di ba, before tayo maging professional nurse, we will undergo baccalaureate program na 4 years para masabi natin na kaya na natin na ma-perform ang roles and responsibilities ng isang nurse. Another, it is an orientation of the individual towards service either to a community or to an organization. Another, it has an ongoing research kasi every now and then dapat hindi tayo stagnant lang sa isang field. Kailangan meron tayong progress and development. And then it has a code of ethics, it has autonomy, and lastly, it has a professional organization in which sa atin meron tayong Philippine Nurses Association. So yun yung ating criteria of professions. So we have the term professionalism. So professionalism refers to a professional character, spirit, or methods. It is a set of attributes, a way of life that implies responsibility and commitment. Meron din tayong term na professionalism, which is defined as the process of becoming professional, that is of acquiring characteristics considered to be professional. So ito yung ating mga characteristics of or criteria of a profession. So we have, it has a specialized education. It is important aspect of professional status. In modern times, the trend in education for the professions has shifted towards programs in colleges and universities. So ngayon, pinakakailangan, hindi lang dapat tayo BSN lang. Okay? Very, pinapakilala sa atin ng ating Board of Nursing ang pagkukontinue ng education. So such, mag-undergo ng iba't ibang trainings, okay, mag-undergo ng master's degree, and even doctor programs. Kasi, sa ngayon, to tell you honestly, sa ngayon na dahil nagkakaroon ng improvement yung ating society, mas nagiging malaki yung demand nila sa mga nurses nila. So, hinahanap nila, may masters, okay, doktor ka ba, ganito, ganyan, doctor. So, mahirap, okay, mag-apply ngayon. So, pag kayo na gumraduate ng nursing, so, wag lang kayong RN lang. So, you apply, you advance your education to master's degree and even doctor. Baka gusto nyo ding mag-doctor in medicine, di ba? Mas mabuti din yun, okay? So we have, but it has a body of knowledge. As a profession, nursing is establishing a well-defined body of knowledge and expertise. With this body of knowledge, dito tayo nakakatuto or dito natin nalalaman yung mga basic foundation natin na pwede natin gamitin in the real world once we become a professional nurse. So another, it has service orientation. A service orientation differentiates nursing from an occupation pursued primarily for profit. Many considered altruism or selfless concern for others the hallmark of the profession. Pag ikaw ay passionate with this profession, masasabi mo na you are very oriented to the service, to the roles and responsibility of the nurses. Pero pag ikaw ay oriented na, okay, sige lang, para lang makakuha ako ng trabaho, gagawin ko to. Sige, para lang makakuha ako ng sweldo, gagawin ko to. So, you just have the occupation of being a nurse, but you are not a nurse na professional talaga kasi you are not a service-oriented. So, example lang natin kung hindi ako oriented with my passion with teaching, so isipin ko, sige, magturo lang ako ng basta-basta lang dyan, very minimal lang, hindi ko tututukan yung mga bata kasi for as long as sinusweldohan ako. So, I'm not oriented to my service. So, parang ang liit ng na ibibigay kong tulong sa mga ibang tao. Kasi nga, oriented ako sa kailangan kong sweldohan. Ganito, ganyan. Kailangan malaking sweldo ko, ganito, ganyan. So, iba talaga pag ikaw ay isang professional nurse. And then, it has code of ethics. Code of ethics, nurses have traditionally placed a high value on worth and dignity of others. The nursing profession requires integrity of its members. That is, a member is expected to do what is considered right, regardless of the personal cost. We have also autonomy. A profession is autonomous if it regulates itself and sets standards for its members. Providing autonomy is one of the purposes of professional association. If nursing is to have professional status, it must function autonomously in the formation of policy and the control of its activity. So, we are independent. Hindi tayo nakadepende sa doktor, hindi tayo nakadepende sa mga midwives, hindi tayo nakadepende sa pharmacists, medtech, kung ano pa man dyan. We are independent and we are autonomous. Okay? So it has a professionalization, or the another criteria of profession, it has ongoing research. Increasing research in nursing is contributing to nursing practice. In the 1940s, nursing research was at a very early stage of development. In the 1950s, increased federal funding and professional support helped establish centers for nursing research. At such, ito din yung nakatulong para mas ma-improve natin yung ating profession. So, next na i-discuss natin is the Carper's 4 patterns of knowing. So, kailangan natin tong malaman para maintindihan natin yung scope ng profession natin. Okay? So, kasi dito, yung practical nurse or the practices of nursing na di-discuss dito sa 4 patterns of knowing, or the growth of professionalism. So in healthcare, Carper's fundamental ways of knowing is a typology that attempts to classify the different sources from which knowledge and beliefs in professional practice, originally specifically nursing, can be or have been derived. It was proposed by Barbara Ayer Carper, a professor at the College of Nursing at Texas Women's University in 1978. So meron tayong 4 na patterns. First, we have empirical. Pag sabihin nating empirical, it is a factual knowledge from science, okay, or other external sources that can be empirically verified. Pag sabihin nating empirically, it is based on evidences. Nakikita natin. Okay? Pag sabihin naman natin personal, knowledge and attitudes derived from personal self-understanding and empathy, including imagining oneself in the patient's position. Kung ano yung paniniwala natin. Kasi paano tayo nahulma ng environment, also your family, okay, paano mo gihulma yung sarili mo, okay, nagkakaroon ka ng personal knowledge and personal attitude that may be different to another, because again, individuals or tayo ay magkakaiba and we are all unique. Another patterns of nursing, we have ethical. The attitudes and knowledge derived from ethical framework, including the awareness of moral questions and choices. So dito, kumbaga binibase natin if nasa tamang desisyon ba tayo or nasa mali ba tayo. So winuweigh natin yung right and wrong. Kung ano yung accepted ng society at yung hindi accepted ng society. And last pattern of knowing, we have aesthetic. Awareness of the immediate situation seated in immediate practical action, including awareness of the patient and their circumstances as uniquely individual and of the combined wholeness of the situation. Another na i-discuss natin na to have a overview. Okay, sorry. To have an overview of the professional nursing practice, we have the nursing expertise theory ni Patricia, yun. So, nahirapan ako mag-pronounce. Patricia Benner. Okay, so we have stage 1. It starts with novice. No experience or nursing student, performance is limited. So, example kayo, you are novice. Wala pa kayong experience. And once magkaroon kayo ng experience sa hospital, still novice pa rin kayo. Stage 2, the advanced beginner. They demonstrates more generally acceptable performance. He or she has experienced enough real situations to make judgments about them. Okay. Stage, I think, if tatanungin ako if regarding my knowledge on the being a nurse, kumbaga sa hospital, a clinical nurse, I'm an advanced beginner. Why? Kasi I do not have the good, hospital experience, kasi hindi umabot ng 1 year ang yung experience ko sa hospital, as have been in the community setup. So mas nagustuhan ko yung community health nursing and also ito nga nursing education. So stage 3, sila yung mga competent nurse. So they have at least 2 to 3 years na experience. Pag stage 4 na proficient, they have 3 to 5 years of experience. At pag stage 5, sila yung mga experts. So they demonstrates highly skilled, intuitive, and analytic ability in new situation. Usually, nakikita natin to sa mga supervisors. Yan. Kasi they are, kumaga, dahil na tumagal na sila. Dito kasi sa atin, pag mag-a-apply ka sa hospital, you will start as a basic nurse. Hindi dire-diretso. Kahit may masters ka pa, ipapastart ka talaga from the bottom until mapunta ka sa top. Ganun talaga siya. Kasi syempre, kahit pa masters ka, kung wala ka ring experience sa hospital, still you are a novice. So these stages, okay, ito yung nafa-follow natin. Na once tumatagal ka as you go along with your profession dito sa career sa isang area ng isang nursing or field of nursing. So, na-improve yung knowledge mo, na-improve yung skills mo, thus nagkakaroon ng promotion kung saang stage ka na ba sa nursing expertise. Okay? So, now let's discuss the roles and functions of the nurse. So, the caregiver or first role of the first role of nurses is being a caregiver. Okay? So, very kilala. Okay, tayo ay mapagbigay or ang center ng ating role is by giving care. So the caregiver role has traditionally included those activities that assist the client physically and psychologically while preserving the client's dignity. Next, a function or roles of a nurse, we have communicator. Nurses identify client problems and communicate this verbally or in writing to other members of the healthcare team. So tayo yung nagbibigay, tayo yung nagtatanong sa mga patient natin kung ano yung needs nila, ano yung problem nila, ano yung nararamdaman nila, and tayo yung nagsusulat at sinasabi sa iba't ibang members ng healthcare team, this one, my patient needs this one. Okay, doc, ganito siya, ito yung nararamdaman niya. So, ano yung pwede natin ibigay sa kanya na medication? So, through you, nagkakaroon ng idea yung mga members of other members of the healthcare team sa condition ng inyong patient. Okay? Another roles and functions of a nurse, we have being a teacher. Okay? So we help clients learn about their healthcare and health and healthcare procedures they need to perform to restore or maintain their health. So, pwede tayong nagbibigay sa kanila ng demonstrations, okay? Especially, example lang, yung mga patient na diabetic, so tinuturuan natin sila paano magbigay ng self-injection ng insulin, okay? Anong gagawin nila pag yung mga patient na may asthma, anong gagawin nila pag magkakaroon ng asthma attacks, yung mga ganun. So, tiniteach natin sila, binibigyan natin sila mga iba't ibang demonstration on basic nursing procedures. We are also a client advocate. Siyempre, we act to protect the client. Kung lahat ng rights dapat ng ating client hindi natatamaan ng mga iba't ibang members ng healthcare team. Another role, we have counselor. So we help the client to recognize and cope with stressful psychological or social problems and to develop improved interpersonal relationship and to promote personal growth. Another role and function of the nurse, we have change agent. When assisting clients to make modification in their behavior. So, isa sa mga nagagawa natin para maging isang change agent is to give them knowledge para mabigyan sila ng idea na okay, pag ganito pala, so these things na makakatulong sa akin. So, doon na ma-modify yung behavior ng isang patient or isang tao. So, another role, we have leader. So, a leader influences others to work together to accomplish a specific goal. Especially if you are a nursing or a nurse supervisor, kailangan you have the characteristics of being a leader. Another role and function of the nurse, we have the manager. We delegate nursing activities to ancillary workers and other nurses, supervises, and evaluates their performance. Another role, we have case manager and research consumer. Pag sabihin natin case manager, we work with the multidisciplinary healthcare team to measure the effectiveness of the case management plan and to monitor outcome. And for research consumer, we have so nurses often use research to improve client care. So, para nas na-improve yan siya. So, mga expanded career roles ng nurses, okay, we have clinical nurse specialist. So, they are considered to be an expert in the specialized area. We have also nurse midwife, which gives prenatal and postnatal care and manages deliveries and normal pregnancies. We have another expanded career role, the nurse educator, which is katulad ko, I'm a nurse educator. So, we are employed in nursing programs at educational institutions or in hospital and staff education. We have nurse researchers, so we investigate nursing problems to improve nursing care. Another career role, we have forensic nurse. They have the knowledge of the legal system and skill in injury identification, evaluation, and documentation. Di ba, example lang, pag magkaroon ng patient na rape victim. So, di ba, punta natin sila sa authorities, okay, and then nagkakaroon ng forensic para makita talaga na okay, na-rape to siya. So, sila yung mga forensic nurse. Or, pwede din sa mga mga cases na murder, dinedetect nila yan siya. If may forensic forensic doctor, meron din tayong forensic nurse. And also, we have nurse administrator. They manages client care, including the delivery of nursing services. Okay, so yun yung mga iba't ibang roles and functions of the nurse. So now, the last topic na i-discuss natin sa video na ito for Unit 1, we have the scope of nursing. So, based ito sa RA 9173 or Republic Act of 9173. So, the Nursing Act. So, first scope of nursing is to promote health and wellness. The nurses promote wellness in clients who are both healthy and ill. This may involve individual and community activities to enhance healthy lifestyle, such as improving nutrition and physical fitness, preventing drug and alcohol misuse, restricting smoking, and preventing accidents and injury in the home and workplace. Number 2, scope of nursing, we have preventing illness. The goal of illness prevention program is to maintain optimal health by preventing disease. Okay, another, we have nursing activities that prevent illness include immunization, syempre pagbabakuna. Ngayon, we have the COVID-19 vaccinations or the rest bakunas. We have prenatal and infant care, especially sa mga pregnant woman na they have history of critical na condition during pregnancy, infant care, so and prevention of sexually transmitted infections such as AIDS. And then another scope of nursing, restoring health. Okay, so pag nagkaroon ka ng sakit, we need to restore that para maging individual, functioning individual ka sa society. So restoring health focuses on the ill client and it extends from early detection of disease through helping the client during the recovery period. So nursing activities include providing direct care to ill persons such as administering meds or medications, baths, specific procedures, and treatments. And last scope of nursing, we have caring for the dying. So from kung sabi natin nursing is caring for patients from womb to tomb. Okay? From nasa tiyan pa ng mother, nasa uterus pa ng mother hanggang sa mamatay yung patient. Ganun kalawak yung scope ng nursing. So it involves comforting and caring for the people of all ages who are dying. It includes helping clients live as comfortably as possible until death and helping support persons cope with death. Okay? So, yun ang 4 na scope of nursing. Again, we have the promoting health and wellness, preventing illness, we have restoring health, and lastly, caring for the dying. So, yun ang iba't ibang scope of nursing. So, that ends my discussion for Unit 1. Okay, I hope you have learned from this. And if you have questions, clarifications, you can PM me or comment on this video presentation para mabigyan ko kayo ng response with your question. So, thank you and wassalam.